Module 11, Stress and Coping Mechanisms. So what is stress? All of you have experienced stress in your life or are experiencing stress in your life. So let's discuss what exactly stress is. So by definition, it's considered any disturbance in a person's normal balanced state. So a stressor would be that disturbance. A stressor is a stimulus that a person perceives as a threat or a challenge. It disturbs a person's equilibrium by initiating a physical or emotional response. And this is a unique response by each person to a stressor. So something that stresses you out may not stress out another person that's in the same situation. So an example of that is if you have a big test coming up and you're stressing, and the person next to you is completely calm. Okay, so stress affects everyone different and it's unique to how they perceive the stress. Stress can be harmful or it can be motivating. Being stressed keeps you alert and it can make you function at a higher performance level. However, the flip side, on the other hand, if you become too anxious, then you might be unable to focus on the task or think clearly. There are several different categories of stress, and we're going to talk about each one. So the first one is distress. So distress is going to threaten your health, and this isn't the kind of stress that's not good. So an example of that would be if you have continuous financial problems, you constantly have this heavy weight on your shoulders that's going to affect your life. So that is distress. Then we have eustress. So eustress is the good kind of stress. It could be maybe you met somebody and you're going on a date for the first time. It's that feeling of excitement and you're kind of stressed, but it's a good stress. Then we have developmental. So this is associated with life stages. And these are typically stressors that you can predict to occur at certain times of your life. So these stressors may be easier to cope with because you expect them and you kind of can prepare for them beforehand. Next, we have situational stressors. These are unpredictable and they can happen at any life stage and can affect infants, children, and adults equally. So it can be anything. You have a car accident or other type of accident, some kind of big hurricane. So it can happen anytime, anywhere to anyone. They're situational. Then the next category is related to time. So this is when you don't have enough time to do something, and you have this heavy stress because you're worrying about maybe managing multiple demands or trying to rush to avoid being late for maybe work or school. So it's related to time. Then we have anticipatory stressors. And this is when you're anticipating something. So you are experiencing stress on something you're thinking is going to happen in the future. So this can be focused on a specific event, like maybe it's your first day at clinical, so you're thinking about it, you're getting stressed out about it, but it can also be kind of generalized and undefined. So maybe you just have like a vague sense of stress or concern about the future in general, like if something's going to go wrong. The next category of stress is physiological, and we're talking about our body, how stress affects the structure and or function of our body. This includes conditions, diseases, mobility problems. All of those things are considered to put stress on our body, which is why it's important that we understand all of those effects that stress can have, which we're going to talk about later. So some examples would be chemical, like poison, just plain old medications, tobacco. Physical or mechanical would include trauma, extreme cold, nutritional, if you have inadequate vitamins or diet in general intake, biological, any type of infection from bacteria, viruses, fungus, genetic, maybe you're already born with some kind of metabolic issue, lifestyle, so the choices that you make can affect the stress on your body, being obese, sedentary lifestyle, not eating the right foods. And then we have psychological. So psychological are external stressors that could come from work, family dynamics, maybe your living situation, your social relationships. Pretty much any aspect of our daily lives can cause a psychosocial stress on us. So that is the last category of stress. And as you know, maybe some of these you have in your life, and a lot of them overlap each other. So the takeaway from all of these categories of stress is that it is ultimately affecting our health and well-being having stress. It can affect us in a good way, or it can affect us in a bad way. So since everyone has stress in their lives at some degree and at some level, then we need to know how to cope. So these are different styles of coping strategies. The first one we're going to talk about is adaptive. So you should definitely know what the definition of adaptive is and its counterpart, maladaptive. So adaptive coping would include healthy choices. So for an example, if a patient went to the doctor and was diagnosed with hypertension, having high blood pressure, may choose to modify their lifestyle, eating better, exercising to lower their blood pressure and prevent any other complications. That would be an adaptive coping strategy. Also, something that plays a role is a good support system. So if a person has, a family member, a friend, a loved one that can help the person adapt to the stress by, providing emotional support, encouraging them, helping the person make their way, cope through this, then those are adaptive coping strategies. On the other hand, we have maladaptive. So this is not a healthy style. This is an unhealthy style of coping, and it's only a temporary fix. So some people may choose to cope in unhealthy ways. I think we are all a little bit guilty of that at some degree. So when you're really stressed, some people may overeat, they may drink alcohol excessively, they may smoke, they may have some excessive sleeping, maybe they'll sleep all day, or even like avoidance behavior, withdrawn. The list is endless, but those are maladaptive coping strategies. Those are things that we do not recommend. We want the patients to do adaptive coping strategies. So continuing with coping strategies, we have 3 general approaches for coping depending on the situation. So the first one is alter the stressor. So in some situations, if a person is able to take some actions to remove or change the stressor, then you're going to solve the problem. For example, change jobs. Your job is a huge stressor, then get a new job. Second would be adapt to the stressor. So this is when you need to change your thoughts and behaviors related to the stressor. So it's kind of like accepting it. So if you are really stressed out about going to clinicals, that's not really something that you can stop or change. So you're going to have to adapt to it. You're going to have to change the way you think about it. And then the third approach would be to avoid the stressor. So you might find that, for example, a relationship, that the person is too stressful for you, in whatever definition that may be for you. Maybe you've tried to change the dynamics of the relationship, but that didn't work. So you need to avoid the stressor. You need to end the relationship and get away from that person who is the stressor. So we're going to talk about adaptation. So adaptation is adjusting to the stress or stressor. And a successful adaptation allows for normal growth and development and effective responses to changes and challenges in daily life. And the outcome really depends on the balance between the strength of the stressor and the effectiveness of the person's coping mechanisms. So it's kind of like changing your mentality, accepting that you cannot change something, so you're adapting to it. You're balancing out the stress and non-stress. So the ability to adapt to these stressors depends on a couple things. So intensity of the stressor, is it very, 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 very stressful on the, scale of intensity? Then if that's the case, even if you have a positive attitude and great coping skills, excessive amounts of stress can lead to maladaptation and disease. Okay, even with the strongest person who has these great coping skills, if the intensity of the stressor is just overwhelming, then it can lead to those bad coping mechanisms we want to avoid. Some people actually succumb to illness even after experiencing just a few stressors, while others may adapt to multiple really, really intense stressors. So everybody is different. It's the way we perceive things, it's the way we cope with things. So again, it really just depends on your effectiveness of coping skills. Each person has a different ability to tolerate stress, okay? But even if you have a person who is able to manage all of the stress and it appears that, they're not overwhelmed, at some point, everyone has a breaking point where stress will become overwhelming for them. Personal perception of a stressor. So a person's perception may be realistic or exaggerated. And if your previous attempt at adaptation has been successful, then they might try it again. Okay, like I said, everybody's different. Everybody perceives the stress different. And sometimes you exaggerate it. And sometimes all of these things are just happening in your mind and you're not even saying it out loud. But this is a peek into all of our minds because we all tend to have this way of thinking just at different levels. Your overall health status. So stressors can cause a healthy person to engage in constructive adaptation behaviors and improve health. Just like that example, if you go to the doctor and you're diagnosed with hypertension, high blood pressure, then you will have that positive response and try to change things so you'll have a better outcome and prevent other complications. But then if you're already sick, say you have some other chronic condition, and then you were diagnosed with hypertension, you just might be, overwhelmed and exhausted to try to do anything about the hypertension. So your overall health status at that time does impact your ability to cope and the approaches that you make for coping strategies. Other factors that influence adaptation would be a good support system. So a good support system can help a person adapt to stress, provide emotional support, help the person solve problems. It can also help provide financial support or physical support like a place to live, household help, childcare, transportation. This can be from family, friends, neighbors. So research has shown that if you have a good support system, you're going to have better adaptation. Then we have hardiness. So this is a term that's used for people who, despite having overwhelming stress and stressors, they tend to have this quality called hardiness that allows them to still maintain their adaptation. And it's based on a couple of factors. You can read it in your book, but this is just, those people who have so much stress in their life and they're still able to hold it together. Personal factors that affect adaptation could be age, developmental level, and life experiences. So all of those affect a person's response to stress. Next, we're going to talk about physical responses to stressors. And this is where Hans Selye comes in. So Hans Selye is considered the founder of the stress theory. He was born in the early 1900s. He was an endocrinologist/scientist. And he was the first scientist to identify the way that the body reacts to stress. And he says that non-specific bodily responses are shared by all people. So everyone responds to stress physiologically the same way. And he talks about the general adaptation syndrome, GAS, having 3 stages. The first stage is the initial alarm stage. Second stage is resistance, aka adaptation. And 3, the final stage, is either going to be recovery or exhaustion. So this theory, this general adaptation syndrome or GAS, you should be familiar with. So this is from your textbook and it kind of lays out the general adaptation syndrome. So you can kind of read through this, take a look at it. We are going to talk about each stage coming up. Again, another kind of visual for you to look at. Okay, so now let's talk about each stage. So the first stage of the general adaptation syndrome or GAS is the alarm reaction stage. And you're probably familiar with this. This is the fight or flight response to a stressor. So when you get scared or when something unexpected happens, you have a flight or fight response. And a lot of things happen when this happens. Involuntary body responses. This includes a lot of hormones. So the endocrine system starts secreting a bunch of hormones. Your nervous system also secretes hormones. Your cardiovascular system starts to change. We have vasoconstriction. Your blood pressure goes up. Your heart begins to contract harder. Your bronchioles open up to let more air in. You start to have more availability of glucose. Your body holds in sodium, which then holds water. You have decreased peristalsis in your GI tract, and there's increased blood flow to muscles. So it is believed that all of these things happen to keep you, the human, more alert and to give you energy to take care of yourself and to do whatever you need to do to stay alive. Okay, so the first stage is the alarm reaction stage, where your body goes into this mode and pretty much every body system is doing something. Your cardiac, your respiratory, your urinary, your GI tract, your musculoskeletal system, especially your endocrine system with all of these hormones. Again, alarm reaction is the first stage of general adaptation syndrome, fight or flight response. Cardiovascular system, vasoconstriction, the heart's going to contract harder, increased blood pressure, your bronchioles are going to open, decreased peristalsis. Just remember these things. This is happening in the first stage. Then we have the resistance stage. So this is when your body tries to normalize the vital signs and the hormones. So after that first stage, when all of those things are going, out of balance, because normally we're not like that, and your body is now trying to prepare you to fight or flight, right? Fight the enemy or flee from the enemy. Then the resistance stage is going to be the body is trying to cope, protect itself from the stressor, and maintain homeostasis. So it's going to involve physiological and psychological coping mechanisms. And again, they're trying to get your body back to normal after this. So if the stress is too great, like, and let's say we're talking about a physiological stress, maybe it's an infection. So maybe a patient has a really, really, really bad infection and they just can't resist it. They can't return to homeostasis. Then that person is going to progress into the third stage of GAS. And it will be either exhaustion or recovery. So exhaustion is physiological responses in this exhaustion stage include vasodilation, decreased blood pressure, increased pulse and respirations. Physical adaptive resources and energy are depleted. So you're exhausted. Your body has been in this fight or flight, trying to keep you alive. It hasn't been able to adapt well. So now your body is literally exhausted, and all those resources that it was using to maintain homeostasis is failing. So exhaustion will usually end in injury, illness, or death. Okay. Recovery is if the adaptation was successful. If that second stage was successful, then the final stage is going to be recovery. So for example, if a patient, if a married couple had a miscarriage and they went to a support group to work out their relationship, maybe they were having problems and they end up staying together, they were gradually able to resolve their grief, then that would be a recovery period. And yes, a sick patient and a married couple who had a miscarriage are two completely different things. But again, we're talking about all different kinds of stress. It could be stress on the body from trauma, infection, surgery, or we're talking about stress in your life. You're getting a divorce, you just lost your job, your grandma just passed away. Those are all stress, and this is a model of all types of stress, because what this endocrinologist, the scientist, Hans Selye, is saying is that we all react the same physiologically to all types of stress. Okay, so we're going to have what first stage, second stage, and then the third stage will either be exhaustion or recovery, depending if stage 2 is successful or not. Okay, so physical response to stressors. So we have a local adaptation syndrome. When you perceive a painful stimulus, especially if you have in your legs, like your extremities, you will immediately and unconsciously withdraw from the source of pain. So maybe you stepped on a nail, you were barefoot, you felt the pain, and you quickly, bent your knee up because you felt that pain. That reflex is protective and it's involuntary. And it's actually a predictable response. We know that if we saw somebody step on something and they went ouch and started hopping, we're not going to be shocked that they did that. We're going to understand, oh, they must have touched something that gave them pain. So this would be considered a local response, okay, localized. So there's actually two types of localized adaptation syndrome. We have reflex pain response and inflammatory pain response. So that would be an example of the reflex pain response. The inflammatory response is, again, still a local response to cell injury. We talked about this a little bit at the beginning of the semester. So if you have an injury to your cell, and it could be from physical injury, like you bumped your elbow, or we consider injury to a cell being caused by a pathogen, like a microorganism. So like an infection will also cause injury to a cell. Then you're going to have the same thing happen regardless of what injured the cell. Okay, the mechanisms are the same. There's going to be inflammation. And we know the 5 cardinal signs of inflammation. We have pain, heat, swelling, redness, and loss of function. So that is something that's going to happen with any type of cell injury, which is a stressor. It doesn't matter what caused the cell injury. Okay, so these are 2 examples of local adaptation syndrome: reflex pain response and inflammatory response. So we also have psychological responses to stress, and this includes our feelings, thoughts, and behaviors. So the first one we're going to talk about is anxiety and fear. So a person who has anxiety, they worry, they feel nervous, uneasy, fearful, they may be tearful, and this is often accompanied by physical symptoms like nausea, trembling, and sweating. Fear is an emotion or a feeling of apprehension or dread from an identified danger, threat, or pain, and that danger may be real or imagined. So it could just be something that you are thinking about, and that can give you fear. But both anxiety and fear initiate the release of epinephrine, which then stimulates our sympathetic nervous system and prepares that person for fight or flight. So if you remember from that general adaptation syndrome, this is stage 1, fight or flight. So all of those physiological changes, the hormones, the heart pumping faster, all of those things are going to start to happen when you have anxiety and fear. So these people who are living with anxiety can have physical and emotional and spiritual exhaustion because the body is constantly using those resources. They're constantly in a state of fight or flight. Then we have ego defense mechanisms. So these are unconscious mental mechanisms that make a stressful situation more tolerable by decreasing the inner tension associated with the stressors. So this includes some defense mechanisms like denial and projection. So when used sparingly, so if you do that just a little bit, then it's actually can be beneficial. But when you overuse these types of defense mechanisms, they can give us the false illusion that we're coping, because that's not actually the way we should be coping. And if psychological defense mechanisms are inadequate to cut back that threat and restore equilibrium, then the person might develop an anxiety disorder. Okay, so that's not something that we should encourage to use, these ego defense mechanisms. Then we have anger. So anger, when expressed appropriately, like for example, if you verbally state your side or why you're angry, that can actually be adaptive because you're releasing your own feelings of tension. You're getting it out in the open and you'll feel better. And the other party, if there's another party involved, then they'll hear it and hopefully that can help resolve whatever issue is going on. Even if your verbal expression of your anger, it can still be destructive if it continues after you say it. So maybe you said it, you feel better, but whatever was making you angry still continues, then that's not going to solve anything. Then we have depression. So depression sometimes is associated with unresolved anger that resulted from stress. It's normal to feel depression in response to any loss or traumatic event, but long-term depression is a reason for concern. So there are consequences if you fail to adapt to the stress. So continual stress is a result of repeated central nervous system stimulation and elevation of those hormones that we talked about. And continual stress brings out long-term changes in, not just one body system, but it can be multiple body systems. So people who use maladaptive coping strategies, like we talked about, like maybe they drink a lot, alcohol, or they overeat, then they're actually creating more stress on the body, which is going to contribute to the overall, disease and illness of the person. So some more consequences of failed adaptation are here on this slide. So I'm not going to go through the first set, but I do want to talk about the second set. So this is stress-induced psychological responses. So first would be crisis. So a crisis is when an event in a person's life drastically changes a person's routine. It's a crisis. It's interrupting their daily life. And the person's usual coping mechanisms are ineffective. And then that results in lots of anxiety and they're not able to function adequately. And this can happen to anybody. Then we have burnout. That really good example is nurses. So if you're working a lot, there's a lot of physical and emotional demands at work. And if you're not able to cope effectively with those demands, then you can experience burnout. Then we have post-traumatic stress disorder, PTSD, very common with those war veterans. And this is a specific response to a violent, traumatizing event. It could be a big earthquake or a natural disaster, or maybe a person was physically or emotionally abused. Then that person can experience anxiety and flashbacks that could last, from months to all the way the rest of their life. So that would be PTSD. Okay, so let's talk about stress reduction interventions. So we want to promote health. We want to promote adequate nutrition. And there are lots of reasons why someone should have adequate nutrition, but this is essential to maintain the integrity of the immune system. And proteins are needed for tissue building and healing, so we need that in our body. Also, overweight and malnutrition are stressors that may lead to illness. So promoting adequate nutrition, using that My Plate to educate patients is important. Okay, help client establish a routine that includes regular exercise. So exercise promotes physical homeostasis, it improves your muscle tone, it helps to control weight. It also helps heart and lungs to function appropriately. It also helps your emotional homeostasis by promoting relaxation. It reduces tension. Also, during exercise, the brain will release endogenous opioids. So good opioids that take away pain and gives us a feeling of well-being. So exercise has lots of benefits. Then we have sleep. So we should teach them to hopefully get at least 7 to 8 hours of sleep per day. So sleep and rest restore energy levels. They allow the body time to repair itself, and it promotes mental relaxation. So stress, pain, and illness may interfere with the ability to sleep. So sometimes some patients need to identify and start other techniques for to help them relax and to help them actually go to sleep. Then we have leisure activities. So this would mean physical activity or even sedentary activities like reading or watching TV. That can also be a form of rest and it can be restorative. Time management. So people who manage their time efficiently and organize their life routines feel more in control and therefore less stressed. So if you have a plan, that can decrease your stress. Advise clients to avoid maladaptive behaviors. So some people use, as we know, maladaptive behaviors in response to stress. So we want to, tell them to avoid unhealthful behaviors like consuming excess caffeine. That includes tea, soda, coffee. We don't want any alcohol abuse smoking cigarettes or chewing tobacco, illicit drugs, abusing prescribed medication or even over-the-counter medication, and avoiding social interaction. They should actually try to socially interact because that can help reduce stress. Okay, so we also want them to cut back on their anxiety levels. So certain things that they can do to have some anxiety relief can help them reduce their stress. Anger management, since we know anger is a common response to stress, we want them to be self-aware. We can help them have a change of perception of self. So cognitive restructuring can help them recognize their negative focus and restructure their thinking in a more positive and realistic way. We want to hopefully identify and have them use our support system. We want to reduce the stress of hospitalization. So illness and hospitalization are stressful for patients and their families. And just in addition to being sick, patients aren't in their normal surroundings. They don't have privacy. They don't have control. So that's one of the reasons why we promote patient-centered care. Okay, this will help reduce stress and overall increase their well-being. We also want to teach patients what to expect from hospitalization and give them some tips to help minimize the stress that they experience while they're there. Spiritual support, we want to employ crisis intervention. So we want to assess the situation and make sure the patient's safe, diffuse the situation, decrease the patient's anxiety, find out what the problem is, and find out what help we can provide for them, hopefully before the crisis hits. And we want to use proper referrals. So if you can, if you see that maybe it's kind of beyond how you can help, then you want to refer them to the appropriate healthcare professional that can help them. Maybe it's going to be a chaplain, like a spiritual representative, a counselor, social worker, etc. Even a different type of doctor, psychologist, that would be helpful also. We're going to talk a little bit about the psychosocial theory. And we mentioned this when we were in the module about health and wellness and how they relate. So this is kind of like that. So patient responses to illnesses are influenced by the relationship among physical pathology, psychosocial health, and overall wellness. And that just means their mind and their body and their spiritual state are all involved in their overall well-being. So these are some psychosocial influences on health, and I think all of us can relate to this. So your support system, your socioeconomic status, coping mechanisms, your success, your family, your diet, your maturity, your education, all of these things influence our health. For example, coping mechanisms, we just talked about that. If you don't have very strong, healthy, adaptive coping mechanisms, then that can have a negative influence on your health. Family, if you have family dynamics that aren't the greatest, maybe you don't talk to your parents, maybe you don't talk to your whole family, and you don't have a support system, that could influence your health. Your diet, that's an easy one. If you don't make good food choices, that can influence your health. Your pets can have a great influence on your health. It can be your companion, your friend, your pet can help you de-stress. But then maybe you're allergic to your pet and that can have an influence on your health in a negative way. So again, all of these things can influence your health and well-being. Self-concept. So this is your overall view of yourself. So this can be based on your physical appearance, your sexual performance, your intellectual abilities, how great you are at work, your friendships, your ability to problem solve, and just your unique talents. So this is something that we think about ourselves. We're judging ourselves. There are a lot of factors that affect our self-concept. We're going to talk about a few of them. The first one is gender. So certain aspects of self-concept differ by gender. So one example of that would be if there was a man and a woman applying for the same promotion, and the man gets it just because he's a man, and the woman, even though she had more experience and more education, she did not get that promotion. So that would affect her self-concept. Developmental level, so that would mean depending on what level we're at is how we define our self-concept. So for example, if you are in adolescence, We could take in our friends' opinion and social media and base our self-concept on that. Versus as we become more mature, we're less likely to view, our friends and social media as they'll have less influence on our own ideas about who we are. Then we have socioeconomic status. So research has been done. If you have a low socioeconomic status and social isolation, that actually correlates with depression. Family and peer relationships. So the family that a child grows up with strongly influences their developing self-concept. So the environment they're in at home really fosters, the way they feel about themselves. So the components of self-concept include body image, role performance, personal identity, and self-esteem. Body image. This is a mental image of your physical self. And this is influenced by ideal versus perceived and actual body image. So people don't always see their own bodies as objectively as others see them, right? You see yourself in the mirror. What you see, what you touch, what you smell might not be the same as how someone else perceives you. So the closer the match between a person's ideal body image and sensory input about their own body, okay, the match, the more positive a person's body image is likely to be, if that makes sense. Okay, appearance and function of the body. So if you have a physical disability, like maybe you're blind, deaf, then those kind of things can interfere with the development of a positive body image. So if you have a child that was born with some type of physical disability, then they're going to have a higher incidence of poor self-concept and may actually be depressed. Then we have gradual versus sudden changes. So gradual changes in physical appearance occur naturally throughout life. We get bigger, we get smaller as the body matures and grows old. And most people will adapt easily to this gradual change. But in contrast, when changes appear abruptly, like an acute illness or an accident, then it's much more difficult to accept it. So denial, anger, self-hatred, and despair are just some of the things that can happen after an abrupt change in a body image. An example of that, maybe you got in a car accident and they amputated a leg. That is a sudden change that can cause somebody to become depressed and angry. Role performance is simply the actions a person takes and the behaviors demonstrated in fulfilling a role. So it's how well you do something. So if you are a spouse, a husband or a wife, how do you fulfill that role? If you're at work, how do you fulfill that role, and so on. Moving on to personal identity. So this is your view of yourself as a unique human being, different and separate from all others. Personal identity develops over time, beginning in childhood when you identified with your parents, and then later with your teachers, your peers, and so on. And unlike body image, which is expected to change over time, your personal identity is relatively constant and consistent. So it is culturally determined and learned through socialization. And lastly is self-esteem. This is how well a person likes oneself. So it is a difference between the ideal self and the actual self, meaning between what I think I ought to be or want to be and who I really am. So the balance between our self-expectations and our true abilities can really be interesting. So when we succeed beyond our ambitions, we experience a high self-esteem because we did it, because we raised a bar for ourselves and we exceeded it. But when we aim for an ideal self that's beyond our capabilities, then we risk a loss of self-esteem. So we set the bar, we couldn't reach it for ourselves, then you might have lowered self-esteem. And this is something that we do to ourselves. Okay, just a little bit about psychosocial illness of anxiety. This is a common emotional response to a stressor. Okay, usually an unknown stressor, you're kind of anxious about something. It results from psychological conflicts. You can have those physical symptoms that I mentioned earlier, and it can range from mild, moderate, severe, and even disabling. Another illness would be depression. It causes sadness. It can occur in any age group. Important that you assess your patients for depression, especially those that have risk factors. This is a psychiatric diagnosis, so they need to be evaluated by the appropriate healthcare provider. And for anybody who's depressed, you want to consider suicide prevention strategies, and that's something that you will learn about as you move on through your nursing program. And that concludes this module.